Medication and Drug Use by Dr. Cecilia Roberts, performed by Dr. Franz Grenier. Dan receives many calls about drugs or medication and diving. Often, prior to entering a dive training course, divers or instructors will call Dan to ask their opinion. This can be quite a complex issue and doesn't always have simple answers. One of the biggest obstacles is not so much the drug, but the reason for taking it, and the fact that there isn't necessarily solid information available to determine whether or not it is safe to dive. Aviation and military standards can sometimes be applied. A recent paper published by Dr. Marguerite St. Leger Dowes looks at the prevalence of the use of illicit or prescribed drugs in recreational divers in the United Kingdom. Over 57% of the respondents admitted taking over-the-counter medication within 6 hours prior to diving. This often included analgesics and decongestants. Another 23% used prescription medication, of which 10% was specific for cardiovascular problems. Others included respiratory, hormonal, gastrointestinal, antibiotic, psychoactive, neurological, or musculoskeletal medication. Somewhat alarmingly, many of the drugs reported are prescribed for the treatment of medical conditions that in and of themselves would not be compatible with diving. When looking at illegal recreational drug use, 22% of the respondents admitted to using one or more illegal or illicit drugs since learning to dive, including cannabis, cocaine, ecstasy, benzodiazepines, amphetamines, LSD, heroin, and magic mushrooms. Around 3.5% used these drugs during the last month to a year prior to the data collection. The use of cannabis, cocaine, and ecstasy. There were also several individuals that reported the use of cannabis, cocaine, and ecstasy within 6 hours of going diving. So we know that many divers use prescription or over-the-counter medications and even illegal recreational substances while diving. Individual factors, existing medical and physical conditions, and mental and physical fitness requirements for diving must all be taken into consideration when addressing this topic. Diving, that is being subject to immersion, and the pressure and gas gradients that come with it, represent an important variable when considering the safety and effectiveness of medication. Not only do the drugs potentially affect diving, but there's an interaction between diving and the medication, as well as the underlying condition that should be considered. So what are the major concerns? Well, drugs that affect alertness and consciousness or lead to drowsiness and sedation, and even impaired cognitive function or integration of thought and action, would be a concern. Some may affect neuromuscular strength or coordination. The interaction or cumulative effect of nitrogen with certain drugs like sedatives or tranquilizers may make inert gas narcosis worse and occur at a shallower depth than usual. Other drugs may increase the risk of developing oxygen toxicity, which may be a bigger threat when diving on oxygen-rich gas mixtures. Changes in blood acidity due to breathing patterns during diving may also affect the metabolism of certain drugs and contribute to other complications. Certain drugs like diuretics, alcohol, or caffeine can lead to dehydration, which also increases the risk of decompression sickness. Exercise tolerance or ability to work underwater may be affected by certain medications like beta blockers. Lastly, it's important to consider other divers and their safety when evaluating drugs and the diving environment. When looking at the pharmacology of drugs, we need to consider how it's absorbed, distributed, and eliminated from the body. The combination of immersion and pressure may affect the way in which drugs are distributed through the body, whereas breathing elevated quantities of oxygen may also increase either activation or deactivation of drugs. There are 7 key questions that should be asked in any situation where drugs or medication are considered. Firstly, what the drug itself is and how this will affect the individual. Secondly, what is the reason for taking the drug? What is the disease or disorder that the person is treating? This may be a bigger problem. What kind of diving is being planned or going to be performed? The more elaborate the dive, the greater the risk of any unstable medical condition. What potential drug disease interactions may there be? In other words, where the drug and the medication may interact. What drug diving interactions are possible? Will diving affect the drug or vice versa? Is there a diving disease interaction? In other words, may the condition be worsened or affected by diving irrespective of the medication? And finally, how is the overall safety affected? In closing, the underlying condition, as well as the extent of organ function, mental alertness, and exercise capability should all be considered, as well as the potential for unexpected side effects or medical complications. It may be necessary to change or, in some cases, cease from taking medication. However, changing medication, whether introducing or removing, is in and of itself a potential risk factor, and divers should wait at least 24 to 48 hours before diving after any such change. Never take medication for the first time underwater. Although the issue regarding medication or drug use in diving is not easy, following a systematic, rational approach can formulate a better, consistent response.